Okay, quiz. What do these things all have in common? Sunscreen, condoms, seatbelts, and life jackets. These are all examples of harm reduction. Harm reduction simply means making things safer. We all do things that have some risks that we're not going to stop doing. We aren't going to stop driving cars, having sex, or bringing our kids swimming. So when we do, we try to decrease the risks with seatbelts, condoms, and life jackets. Humans have always used drugs of some sort or another. That's just part of the human experience, and it isn't going to change. Drug use can come with risks, and this is especially true when the toxic street supply is involved. Addictions cause people to continue to use drugs even when they know their next dose might kill them. I've heard it said that people with addictions need to learn from the natural consequences, and that will help them quit. Well, despite knowing how dangerous it is, stopping may not be in the cards for someone yet. That's what addiction is. So in the meantime, reducing the risks just makes sense because the natural consequences might kill them. I'm Dr. Jill, and I'm an addictions doctor in Victoria, Canada. The idea of harm reduction is something we all practice in our everyday lives, but the term itself is now mostly used when we talk about addictions. In the early 1980s, people who used drugs in the Netherlands wanted to decrease the transmission of HIV. They started the first needle exchange programs that spread quickly to other countries due to its success. This came to be known as harm reduction. In the world we live in now, with a deadly toxic drug supply that's the leading cause of death in adults under age 60 where I live, harm reduction programs are as critical as ever. Just a few examples include naloxone distribution, supervised consumption sites, drug checking services, and safer inhalation kits. Harm reduction saves lives, helps keep people healthy, and decreases the risks of transmissible diseases. It's also a huge cost saver, and this I can't emphasize enough. Harm reduction programs save millions of dollars because it's always cheaper to prevent people from getting sick than to treat them when they do get sick. For example, a safer inhalation kit costs less than $1, while treating someone for hepatitis C who contracted it because they didn't have one of these costs around $60,000. And who do you think ends up paying for this? We all do. Another benefit when people access harm reduction services is that they get connected to healthcare, to social services, and yes, they even get connected to detox and treatment programs. As a doctor who's seen many people in recovery from this deadly disease, I can't think of a single one of them who didn't access harm reduction services along the way. So if you say you're against harm reduction, you're saying you're against saving lives, against decreasing disease, and in favor of wasting millions of dollars. And if you say harm reduction doesn't work, then you're just wrong. More to come on this subject soon. Bye, everyone.